Now, while Gauteng has been the epicenter of the fourth wave of COVID-19, cases in the Western Cape have started increasing as well. Last night, we saw 4,599. Today's figures also around those levels. Let me just get it. It's at 3,655, which is actually quite low compared to the previous recordings. Let's hear from Dr. Keith Cloete, head of the Western Cape Health Department. Doctor, thanks for your time. We appreciate it. So we saw a slight decline in terms of your infections over the past 2 days. But of course, you still have to have those measures in place to make sure that it doesn't climb drastically. What are you doing?
Good evening, Shahan, and good evening to the viewers. So we have been watching very carefully the increase in cases, and like Gauteng is very similar. We're seeing a very rapid increase in cases. So over the last 7 days average is about 3,000 cases, and we expect it to go up to about 4,000 over the next 7 days on average. So what we are doing is encouraging people to get vaccinated, firstly. And secondly, to wear a mask, to get good ventilation, and meet outdoors if at all possible, and avoid big crowds. So that's the standard message that we give everyone. Like you've said, we're watching, and it's the same pattern emerging in the Western Cape. Although we have very high case numbers, our hospital admissions is relatively low compared to the previous comparison between case numbers and hospital admissions. So from our perspective, we are ready. We're getting all our systems ready for hospital admissions, oxygen, beds, everything, staffing. But we're really just encouraging everybody to try and break the transmission through the behaviors in public spaces.
Yeah. Just tell me what your hospitalizations are sitting at in terms of numbers now.
We're just over about 1,000, 1,200 for our province. And it's split roughly between private and public, between 560 and 600 between the two.
And deaths?
Deaths is extremely low, Sean. And we've actually not been one of only 2 provinces, I think, that has not shown any uptick in deaths yet. So our death rate is still one death per day. Like today, there was 2 deaths reported as part of the figure that you quoted. But the death rate in the Western Cape has remained low. Yeah,
it is unfortunate that South Africa hasn't really been recording whether or not people are dying related to the Omicron variant or not. We were told that, specific tests have to be done in that regard, and it's not really being done. Is the Western Cape looking into that at all?
No, what we do is we obviously record the deaths. With a positive or associated COVID case. There's no genotyping specifically. We know that people that would be dying now from it, it's in all likelihood, if they got ill in the last 10 days or so, it's in all likelihood that it will be Omicron. That's why we're saying we are tracking the deaths. There's not been any increase in this fourth wave of the low base that we had in between waves.
Yeah.
We also track it with the excess death. And because of that, there's no extra death. So we're not specifically looking for Omicron, but we can obviously by clear association say that if it happens now, there will be an association that it is likely to be the Omicron variant.
Yeah. So let's talk a bit more about vaccinations. I know you mentioned that at your first answer, but in terms of those numbers, we heard from the health minister today. He says we're nowhere close. We're actually 100,000 short per day to actually reach our target when it comes to vaccinating a large part of the population by the end of the year. Where are you standing in the Western Cape?
In the Western Cape, I think it's quite known to everybody. We have the highest vaccination rate per 100,000 people. So at this point in time, our figures is that around about 54% of everybody in the Western Cape over the age of 18 has had at least one vaccination. Our figure also for fully vaccinated is at 46% of everybody over the age of 18. If you take that breakdown and you take fully vaccinated over the age of 60, we are close to 66%, also the highest in the country. It drops down to 50 to 59, and then it drops down in the age groups under 50. So we have certain parts of the Western Cape where over 60s are approximating 80% coverage in certain parts of the Western Cape. So in terms of the protection, and that's what we've been tracking, is hospitalizations and severe illnesses don't seem to be a big feature now. So it's a combination of previous infection and also the vaccination coverage in the more vulnerable age groups that is probably responsible for the lower admission rates and lower oxygen use that we're currently seeing.
Yeah, and in terms of what you're witnessing through large gatherings, of course, we have thousands of people outside, 750 indoors. There's no adjustment to the alert level in terms of restrictions this festive season just yet. Is that any cause for concern for you in the Western Cape? Because you know you're getting more visitors over this period.
We are very, what we have done, because this is our Premier has called the Provincial Command Council. We had our meeting. The moment we enter the fourth wave, we're now having weekly meetings again, like we've done in each of the peaks. At our weekly meeting on past Wednesday, we heard that in the city of Cape Town and other municipalities are following, that people are actually closing off streets, allowing restaurants to go onto sidewalks and into the streets, and for people to be outdoors. So we're encouraging that. So our concern is more the indoors with poor ventilation. And that's our concern, and that's why we're advising everybody to firstly, if you're indoors, wear a mask. Secondly, let it not be too crowded and get good ventilation in. But if people are outdoors, we are obviously very much encouraging outdoors. What has been very responsible, and we really commend the event organizers in Cape Town for that. You can imagine there were a lot of events, and a lot of event organizers have actually cancelled or postponed events where there would have been big gatherings. And we applaud that, and we welcome that gesture from event organizers.
All right, thank you so much for your time. Appreciate it. Dr. Keith Cloete, head of the Western Cape Health Department.